Hi everyone, this is Zhaoyuan, and I go by Nick. I'm a PhD student in the informatics department at the University of California, Irvine. On behalf of my co-authors, Lu He, Sunit Jariwala, Kai-Cheng, and Yunan Chen, I'm excited to share our work titled, What is your envisioned future toward human AI enrichment in data work of asthma care? Patient-generated health data, PGHD, defined as health-related data collected outside of traditional clinical settings by patients and caregivers, has been increasingly produced and is often expected to be used in clinical practices. PGHD presents great potential to assist healthcare providers in understanding patient situation outside of clinical settings and allowing them to make more accurate diagnosis and treatment plans. However, PGHD are often longitudinal, high volume, and complex. Managing and using them during the short time frame within a clinical encounters can be highly challenging for healthcare providers who have fast-paced workflows and often face burnout. We situate our study in the context of asthma, a chronic condition that heavily relies on daily data collected by patients. Asthma is one of the most common chronic disease, impacting more than 339 million people worldwide. The need for PGHD in asthma care is growing as it offers new opportunities for healthcare providers to treat patients in a more effective and timely manner. However, little to no technology currently support healthcare providers to fully use PGHD. In this work, we aim to understand the current data practice that asthma specialists have adopted to care for their patients and to envision future technology to support healthcare providers' use of PGHD for better clinical practices. We partnered with a medical center located in an urban area on the east coast of the United States. Asthma is an epidemic in this area as it has one of the highest death and disease rates in the country. The medical center provides patient care to over 40,000 children and adults annually for asthma and related illnesses. We recruited and conducted semi-structured interviews with 20 healthcare providers in asthma care with different roles. We then analyzed the data in an inductive manner. Our analysis indicate that asthma treatments heavily rely on PGHD, such as past medication intake, symptoms, and environment data. However, many patients do not have the habit of tracking any data. PGHD collected in the past weeks or month are mostly reported to providers based on patients' memory. Clinicians wish to have a more comprehensive and accurate list of data from patients. However, even when if they have such data, they believe it can be too much for them to review and process. When asked what type of technology they deemed valuable, many believed that AI was a natural fit. To help their PGHD use, most participants expressed their interest in embedding AI system into existing technologies such as EHR system. They imagined that AI system could analyze complex set of PGHD collected longitudinally that is often challenging for them to analyze and make decisions at the point of care, and remotely monitor patients' log data and predict deterioration based on data logged in everyday life. While the envisioned use of PGHD supported by AI were appealing, the participants foresaw several potential challenges associated with AI system, such as requiring healthcare professionals to review the quality of logged PGHD and to double-check clinical suggestions generated by AI system. Moreover, they fear AI system could potentially exacerbate health inequity among patients who lack the access or skills to log their asthma data by excluding them from the healthcare benefits provided by AI analytics. They further express the fear of AI eroding their clinical instinct and replacing their expertise. To adapt the AI use of PGHD in their clinical work, participants believe that they should not blindly trust it after its introduction and instead gradually grow to trust it. Once healthcare providers became comfortable adopting AI in their clinical work, they pictured a future where they could learn from AI suggestions and become better decision makers. In addition to learning from AI to become better decision makers, participants believe they could improve AI system. They imagine reporting unreliable outputs to enhance the performance of AI and adding a human touch to algorithmic outcomes that may not be suitable for patients to receive directly at the health delivery. AI has long been taught to analyze complex data set and provide decision support in healthcare. In asthma care, AI systems have been deployed to screen, diagnose, and treat patients. However, most prior studies have focused on AI systems powered by high-quality patient data that healthcare professionals collected in clinical settings. Building on prior work, this study identified the benefits and challenges of using AI to analyze data collected by patients in their daily lives. As we move into the data-driven world where AI is increasingly used to analyze PGHD for decision support, patients who have access and skills to log high-quality data will benefit from rich AI-assisted insights. Conversely, patients who cannot do so may be excluded from the AI-assisted decision support and may receive a lower quality of healthcare services. Such AI-driven data inequity may further escalate into health inequity. Through the lens of data feminism, we advocate for considering where AI system will be used and the value and needs of patients subjected to such system before their design and deployment. For instance, low-resourced communities such as our study site may face financial and infrastructural challenges in realizing the potential of AI-assisted healthcare. Our study suggested that AI-induced work are heterogeneous and could be managed by multiple stakeholders with different expertise. These stakeholders together, including attending doctors, nurses, medical assistants, pharmacists, residents in various specialists, and the healthcare organizations serve as the human infrastructure of AI. Rather than simply replacing or reducing human labor, AI will create new forms of work that require new alignment between human and technological infrastructure. The infrastructure alignment need healthcare organizations to reconfigure, redesign, and reorganize the workflow, workforce, and work practices to accommodate the demand brought by AI system. Through the lens of data feminism, it is essential to adopt a worker-centered design approach, making labor visible, involving the laborer who will be subjected to the algorithmic system from the beginning stage of the AI development cycle, rather than treating them as an afterthought. Such an approach could allow laborers, researchers, and practitioners to define roles and responsibilities to match skills with different types of AI-induced work, as well as to carefully consider policies, interests, harms, incentives, cultures, and norms from the complex human infrastructure of AI in clinical settings prior to deployment. As the participants envisioned, the future of PGHD-based AI system should not replace clinicians, but rather create synergy between them to improve and learn from each other continuously. The participants stated that they would like to enhance the AI system by ensuring the quality of PGHD input, tracking and improving prediction, and adding human touch. They also envisioned that their knowledge and skills will be enriched by learning from AI system, such as the rationales of decision-making based on the complex input data and the constantly updating guidelines for data use and decision-making. Based on the findings, we conceptualized a new human-AI relationship we call human-AI enrichment. In contrast to existing human-AI relationship, which are primarily from a collaboration perspective and are often one-way, stable, and goal-oriented. Human AI enrichment involves mutual improvement on both the human and AI sides and evolves dynamically in a way that is not necessarily directly related to a particular goal. This new potential human AI relationship could open promising opportunities for future human AI interaction research. Thank you so much for listening to our presentation, and please check out our paper for more details.